Imagine a world where doctors can perform delicate surgeries or dental checkups from miles away, feeling every subtle movement as if they were right there in the room. That's the exciting promise of the haptic internet, and recent breakthroughs are making it a reality. But here's where it gets controversial. Could this technology revolutionize healthcare for remote areas? Or is it just another overhyped gadget that overlooks real-world challenges? Let's dive into the groundbreaking research from the University of Glasgow that puts Open Radio Access Network, ORAN, at the forefront of this innovation, and explore why it might just change how we think about connectivity forever. A team at the James Watt School of Engineering has showcased how ORAN can enable real-time, tactile interactions over networks, potentially bringing massive advantages to those in underserved rural regions. Picture this: reliable internet that supports not just video calls, but actual physical feedback, bridging the gap for people who can't easily access specialists. Their experiments involved something quite remarkable: conducting dental examinations on dentures from a distant spot. To make this work, they integrated an open-source ORAN setup with 4G LTE technology, a haptic controller linked to a robotic arm, and even a simple repurposed USB network dongle that provided surprisingly steady connections. They also leveraged xApps, which are like smart software tools designed to optimize signal quality, boost data speeds, and minimize delays. Think of them as the fine-tuning wizards ensuring everything runs smoothly without glitches. According to the project's press release, the entire system operated with a solid 10 megabits per second bandwidth, exchanging data seamlessly between the base station, the controller, and the robotic arm. This setup isn't just theoretical, it's a practical demonstration of how ORAN can handle the demands of teleoperation, that is, controlling robots remotely in real time. For beginners wondering what ORAN is, it's essentially an open standard approach to building radio access networks, allowing different vendors' equipment to work together without being locked into one company's ecosystem. This openness could lead to more affordable and adaptable tech, but it also raises questions about security and standardization that we'll touch on shortly. The findings were detailed in a paper titled Development of Open Radio Access Networks, ORAN, for Real-Time Robotic Teleoperation, published in the journal Communications Engineering. Dr. Saber Hasuna, a research assistant at the school and the lead author, summed it up perfectly. The ORAN framework holds a great deal of potential for enabling intelligent, data-driven, programmable and virtualized networks, but a significant amount of work remains to be done to demonstrate that potential being achieved in the real world, beyond theoretical modeling. It's this blend of optimism and caution that makes ORAN so intriguing, and this is the part most people miss. While the tech looks promising on paper, real-world testing is crucial to iron out kinks that could affect everything from medical procedures to everyday connectivity. One of the biggest drivers here is an advanced form of telemedicine, where healthcare professionals could virtually feel their patients through haptic feedback, like sensing the texture of tissues during an exam. This could be a game-changer for rural communities, where traveling to a doctor might take hours or days. Imagine a surgeon guiding a procedure in a remote village via a robot arm that transmits tactile sensations back to them. It's not science fiction anymore, and it could inspire more funding into mobile networks overall, with ORAN playing a starring role. Of course, other applications might follow suit, such as remote manufacturing or even interactive education, where students feel virtual objects as part of their learning. But here's where it gets even more controversial. Is ORAN the ultimate solution for democratizing tech, or does it risk creating new divides if only big players can afford the upgrades? In February 2024, Verizon announced they've rolled out over 130,000 radios capable of supporting ORAN, including advanced massive MIMO radios that handle multiple signals efficiently. At the time, they highlighted how ORAN promotes healthy competition and sparks innovation in the radio access network space, offering more deployment options, quicker advancements in an open setting, and a wider array of services. For instance, this could mean rural areas get customized network solutions tailored to their specific needs, like better coverage for emergency telemedicine. Yet, skeptics might argue that open standards could lead to compatibility issues or security vulnerabilities, potentially slowing adoption rather than speeding it up. What do you think? Does the potential of ORAN for haptic telemedicine outweigh the hurdles of implementation, or should we be wary of pouring resources into tech that hasn't fully proven itself? Share your views in the comments. Do you see this as a step toward equitable healthcare, or just another buzzword in the industry? We'd love to hear differing opinions and spark a debate.